So I've got my primary fluid, okay? And I'm going to take my primary macro set. This is a drip chamber. It has no cassette. It is not to be utilized, right, for anything but gravity, all right? I'm gonna open it up where it says tear here. I demoed it in class. I'm gonna recycle it. Now, what's the first thing you're gonna do to the tubing?
Clamp it with the little roller.
Clamp it with the roller clamp. You see that? Clamping it up for you, all right? What's the back check valve do?
Allows for
piggyback down away.
Keeps secondary things in the line from going into the primary line. Perfect, so you do remember a few things. Okay, so remember on the bags you have an area to put in the medication, which we don't do anymore, thank God. And then this port is what we're gonna cannulate. So you're gonna pull that off. Remember, this stays sterile at all times, correct? So I'm gonna take this off the spike. Remember, what you're going to do here is you're going to twist, not poke. So just kind of twist, and this is hard because I'm using Abbott tubing with a cheap bag, all right? So you just have to kind of twist it, all right? All right, now, I'm gonna hang it up. I gotta hang stuff up, that's pretty high, don't see me even. Oh, I see the problem, Houston. Whoops, see the problem. All right, so the next thing that I'm going to do is I'm going to prime the line, but I need to fill my drip chamber to this line. Squeeze, or milk the cow, whatever you want to call it, okay? Moo moo. All right, so I fill this up. Now, what I need to do is prime the rest of the line. So what we're going to be doing now is you can leave this cover on, you don't have to take it off. Okay, you're gonna open up the roller clamp, okay? And you're gonna prime the line, okay? Until all the air gets out of the line. Whoops, my cover blew off because
It's dirty now, right?
it's okay, it's not dirty really.
Okay,
Just pretend.
5-second rule.
All right, not what I use.
That will be on the end, Flex.
Okay, so now what I've done is I've primed this line, removed all the air. Now I'm going to connect it to my, right over here, right, to my INT. This is not connected to anything. So when I connect things to an INT, what's the rule?
15
seconds.
15 seconds, okay. All right. So this one has a green cap on. What's that called?
Chlorhexidine. Oh,
Chlorhexidine, right. So that, is put on the end of the clave and it's cleansed. So I could use that and not have to clean it. But every time you use it, in between that, if there's no green cap, right, you gotta clean it. So I'm gonna clean the clave 15 seconds. 15 seconds. Don't let go of it because it's now clean, right? What you need to do is keep the end of your IV catheter clean. Let the cover fall over. And what you're going to do is you're going to push this into the needleless system and connect it. See, now it's locked, okay? It's locked in place. So now, if I needed to do my drip rate, this is macro. We use macro tubing for what rates?
15 and 20.
For greater than 100 or greater an hour, right? You're going to use your macro. So let's say that I am going to run this. This is a bag of 500 mLs of fluid, and the doctor wants this to go in 3 hours. So what's going to be my drip rate?
150. No, an hour, so you're gonna go 150 times 60.
Divided by. No, you do the.
So let's say the doctor says, hey, infuse that bag in 3 hours.
It's 150 an hour.
Times the hours.
Right.
So what's 500 divided by 3?
It's 150. No.
You got a calculator, somebody? Always use your calculator because you're dangerous without it.
500 divided by 3, you said?
Yeah.
180. 166.6.
166.6?
167.
Okay. Okay, so 166.6 or 67 in adults, we round up. Kids, we never do. So now, 167 per hour, what's the amount I wanna infuse?
So that's 167.
How are you gonna figure out the drip rate?
Divided by 60.
What's the amount that I need to get in every hour?
167 drips.
Good, 160 mLs.
Yeah.
You need the drop factor on the bag.
15.
So you're gonna do 67 divided by 60 times 15.
I'm Abby.
167 by 60 times 15.
Divided by 60.
And that's gonna give you the drops per minute. What is that, Shelby?
41.7 or 42.
42 drops. 42 drops per minute. All right, you gotta put your ends on there, right?
Yes.
All right. So what I literally need to do is do this. Usually what we do is
I'll send you it.
we do for 30 seconds. So about 21 drops. And literally you're gonna count. Okay? It's too fast. Okay, 21 drops.
Or would you do 10 drops for?
You could, it's more accurate over 30 seconds. But you could do 15, absolutely, whatever works. Remember, what's the problem with gravity?
If they move their arm or if they pick up the bag.
Did I flush that before I put that in?
No.
And nobody noticed? Okay.
You're teaching.
Lord have mercy on me. It's the first group, it's my test group.
Your warm-up band.
Can you hold this? Certainly. Don't touch my end, huh? Sterile.
In our defense, there's 2 other nurses in the room.
That's all right, we all were talking. First thing in the morning, we haven't had the coffee. hasn't kicked in. Okay, so I'm gonna clean for 15 seconds, because this is not gonna run like it just did. I'm gonna clean the clay for 15 seconds, right? And now, what's the amount of flush that I can?
3 ml.
Depends on the facility. All right. So now I'm going
KB Hospital is 2.
2, because we're cheap.
Okay.
Okay, there we go. Okay, you're gonna find 5 ml flushes in the clinical environment, all right? So what am I gonna do next? I'm gonna pull back to see if I can get a blood return.
Do you want the blood return?
Linda.
Yes, you wanna, okay?
Right, because you want to check to make sure.
That's what I was
Correct,
thinking.
correct. And the other thing is, when you're flushing, see, that's the problem with these girls, you can't look at the site, because I got a jury rig under here. But that's all right, I'm over it. When you're flushing, because I'm gonna flush over there too, you wanna hold your hand over the insertion site, just like this, to make sure, over 30 seconds, right, about 2 mLs,
The back pressure doesn't.
that it doesn't swell up, it's not infiltrating, okay?
And if we can't get it, we have to stop, right?
Yes, if you can't push, get somebody. Okay, so I've done 2 mLs, okay? Now, with these flushes, in the acute care environment, you can only use them once. You have to then discard them.
In the sharp container now.
In the sharps now, we used to put them in the trash, but because of addiction, we can't even put them in the trash. We're doing the sharps, I know. So anyway, every time you access the cleave, you have to clean it, okay? So now, I'm gonna connect my IV, 15 seconds. I'm gonna put the locking cover again. Oops.
So you have to throw away something with no needle on it in the sharps?
Yes.
But you can go to
Push
Agway
in
and buy
and
a
turn
needle.
it to the right. I know, but we've got to. And now, again, I'm gonna set my drip factor, right? It's gonna be 21 drops, and you have to count. And it's not that easy. We have a drip station, okay? All right, so we're going now. We're going, all right? Now I'm coming into the room, and I'm going to set up the secondary gravity drip. I'm running some ampicillin. Ampicillin, I got 100 mLs of ampicillin, and I want it to run in 15 minutes.
So you need to run 400 an hour. 400 an hour.
Okay? With a drip factor of 15.
There's 4 and then.
I love this clock thing.
Yeah.
Okay, but how many drops am I gonna count? This is a drop. This is not a cassette.
So how many?
400, you said 4 times as fast, right? Did I say 15 minutes, 100, right?
Yeah.
Okay,
In an hour?
yep.
times.
Times, what's the drop?
15. Yeah.
99.9 or 100 drops.
There you go. This is dripping. This is not milliliter. Okay? Drips, drips, drips. Go ahead, Marcia. You can interject.
Yeah, you got it.
All right. So now, okay, this is all about gravity. This is the only time you're going to use this little hook. You don't need a hook for the pump, but you need it for this in just a moment.
Our new pumps, the new pumps they've come out with,
Alaris,
we're back to gravity.
I know it's bad. Aren't they hard to use? They got all those chambers. They scare me.
Getting used to it.
All right. So the first thing I'm going to do with this secondary tubing, which is shorter, is what?
Clamp it.
Clamp it. All right. Bring your clamp up and give it a clamp and clamp it, just like that. Okay.
Couple inches away.
Yeah. Okay. Now remember, this is sterile, and this needs to stay sterile. All right. So what I'm going to do now is I'm going to cannulate my little bag here. Again, the medication port. And then this is, it's nice, they have a little orange this year on it.
Do you clean that?
Nope, it's sterile right
Okay.
now. I'm going inside the sterile environment with a sterile spike. This is a little difficult, but get it in. All right. Okay. Now what I'm going to do is I'm going to hang my secondary bag up here. Okay. Just a little too tall for me. Come to me. Come to Mama. To get the tape off this and break. All right. Now, how often are you going to change the primary line?
24 hours.
No!
96 hours.
So you're going to fill one of these out at every station, right, with the date and when it needs to be changed. So every time you come into a room, you should have one of these on there, which doesn't happen often. Okay,
And for Madeline, that was just a label.
Here, ready?
just labeling the
Let me hold it
line.
up for Maddie. Here you go, Maddie. Look at that. All right, thank you.
Now, what I'm going to be doing is I'm going to attach the secondary, also called Ivy Piggy, because it's got to be piggybacked into the line. I'm going to clean this clay for 15 seconds. Okay, 15 seconds has expired. I'm going to take the end off. And I'm going to push it in and turn it to the right and lock it in place, just to show you. You don't have to pull on the line, but it's to show you that it's locked. Now what I'm going to do is I got to make sure when I hang up my secondary, it's compatible with my primary fluid. Otherwise, I can't do this. Now, most IVs are mixed with either sodium chloride or dextrose. I've got sodium chloride running, so I know it's compatible. Okay?
What if it has a 5 dextrose added into the piggyback?
It's
and
okay.
You can infuse it in with the.
Yep.
Okay.
Because what's this valve going to do?
Keep it from getting together.
Getting back.
Getting up into the big bag, back check valve. All right, so now what I'm going to do is I'm going to back prime this with the primary fluid. So what you need to do,
You need to step store here.
it's okay, it's all right, it's gonna be all right. So what I'm gonna do is I'm gonna open this up. I'm gonna open this up. Okay, you see what's happening? See how it's filling?
But with that one dripping so fast, wouldn't it affect the flow rate?
It is. That's right, that's why we don't like to use these, we have to keep readjusting. So now, I have filled, there's a little holes this year, I see what the problem is now.
Here, Jim.
There. All right, so now I've backfilled this. So again, all you have to do to backfill is go like this, open this up, and this primary fluid will backfill into here, which is compatible with this. All right?
And
Now,
that is to make it like a nice open fluid line.
is so you get the whole med dose in. All right?
And does that get the air out of the line too?
Yes. Now, in order to run, yes, Tiara.
What did you do to prime it? You just unlocked both clamps?
Yes.
Okay.
And actually, I just kind of made this go a little faster, Okay.
It's all, remember, it's gravity.
Gravity.
So the one that's gonna run is the highest one. So if you wanna backfill it, you're gonna put the little med bag low and you're gonna put the big bag high. When you want
all
the
gravity.
little bag to run, you're gonna do the reverse. So who's ever on top runs.
King of the mountain.
King
Look
of-
at that.
Okay, so now, because this is clamped, what's gonna happen to run the secondary, it's all about gravity, this goes lower. I'm gonna turn this one on, okay, and you're gonna regulate it with this clamp. See this? See? 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 Okay.
I see.
Okay, so now, all right, I'm gonna count 99 drops. In 15 minutes, this will be done. You need to have a little alarm on your, right? Because you need to come back in 15 minutes and shut this off and come over here and re-regulate this, because this is not to go at 99 drops per minute, correct? Okay, you get it now?
What is it supposed to go at?
What
That's
was
the one
original?
that was supposed to,
42,
42 drops, right?
21 for 30.
Okay?
so if that one runs out
Then you'd re-regulate it.
and we don't come back,
This is
that
gonna
one's
run
gonna,
really fast and you're gonna have an overflow, right,
Okay.
of fluid. And going in the patient, too fast.
So the fact
And
that
then-
you lowered this, I'm sorry.
that would be actually considered a med error, right? Because that's a
Kind of.
prescription.
It's supposed to go at a specific rate. And that's the, gravity years ago, sometimes, even though you had it set at the 40 drops, the patient would move their arm and the whole bag would go in 20 minutes, depending on the position. It's very positional. So you don't want to ever use it, really, to infuse continuous medications intravenously. It's too dangerous. We put it through a pump. Okay? Questions, Tiara?
So you mostly just use this for like saline.
No, we use it sometimes. You may use it in the infusion clinic. You may use it to give
OR.
the OR, give them a quick bag. In the emergency room, quick bag. But for floor care, we use pumps,
Okay.
True that.
right?
That's true.
C'est bon, merci.
I have one question. When you made this lower, the primary bag lower than the secondary, you could regulate it with this?
Yes.
And it wouldn't affect that bag? It only affected?
Correct,
the
because it's, again, it's
secondary.
gravity.
Okay.
Remember King of the Mountain?
Even though
This
that-
is not gonna run. This is gonna run. It's higher. It's all
Okay.
about gravity. It's kind of just,
So that sort of stops? and
Yes.
This goes down, okay.
yes. Okay, it's not stopping now because this is closed,
Right, okay.
all right? It's all about gravity. All right, are we ready?
Level will